The dream for most practice owners is to have their practitioners consistently busy with a full calendar of bookings. So most practices have either stagnated with the number of new patient inquiries they're receiving, or they're getting really inconsistent results from their marketing, meaning practitioners are sometimes super busy and then a few weeks later have fairly empty calendars. So to get a consistent flow of new inquiries and new bookings, you need to take a multi-channel marketing approach. It's a mistake to rely on just one form of marketing or promotion at a time. So potential new patients need to receive multiple touch points from different places before they decide to call or book in. Now there are so many options when it comes to generating leads for your practice. So I'm going to run through my two favourites, which actually have the greatest impact when done simultaneously. The first is a monthly direct email campaign to your entire database using platforms like MailChimp or Campaign Monitor. Now, you may have tried this before with mixed results. I find where this type of marketing does fall down is when the message is just too generic. Because we're all overloaded with online marketing messages, if something doesn't cut through the noise and get people's attention, it won't result in new inquiries. So what I recommend is a focused message, not too long, 600, maybe 800 words, which outlines a specific ailment which some people are suffering from right now. So when they read the headline and content, it feels like you're talking directly to them. So your article needs to use language that they can understand and relate to, as that you explain their discomfort even better than they can. It lets them know that you understand what they're feeling and gives them faith in your practice so they invariably pick up the phone or click through to make a booking. Remember, this marketing email is not a general educational piece. It's a laser-focused way of getting people's attention and then letting them know that you understand what they're going through so they call and book in. One of the keys to this type of direct email marketing is consistency. So it's sent out every 3 to 5 weeks and you keep it going for a minimum of 12 months, although I would suggest it becomes ongoing. The worst thing you can do is run these for 3 or 4 months, then let it fall away to every year or so. You really need to maintain regular contact with your database to have the greatest effect. Now, the second is a very different marketing strategy, although it does work really well in conjunction with a monthly EDM. It's making phone contact with your past patients. So your database of past patients is an absolute goldmine. Depending on which human psychology study you believe, people are between 5 and 8 times more likely to engage with a business they've already spent money with than one they haven't. So by not making contact with these past patients, you're not taking advantage of one of your practice's biggest assets. So you start by dividing your patients into 2 lists. Ones you haven't seen for less than 12 months, the other 12 months or longer. Now you'd normally have each practitioner call their own past patients, but really any of your practitioners can call. And when they do, they use a very short, simple script. So something along the lines of, "Hi, it's Alex from your clinic. We're just updating our records. Do you have a few seconds? Now, we last saw you in April of 2020 with a sore calf. So I just wanted to check on how it's feeling now." You then say nothing and let them talk. If they say it's been playing up, okay, well, let's get that seen to. I have next Thursday or Friday available. Which suits best? Once again, say nothing and let them talk. If they say it's been fine, well, great. You know where we are if you need us. And if you have a friend who might be having similar issues, feel free to pass on my details. Thanks. Now, this strategy does take effort, but if done well, is the fastest and most effective way of filling your practitioners' calendars. So, just to recap, 2 of my favourite strategies for building a full clinic of patient bookings. 1 is a regular, direct email campaign to your entire database, which speaks specifically to a particular ailment, not just a general educational piece. And 2 is phoning your database of past patients with the possibility you can revive the relationship. Good luck, and I really hope these help.